Hello everybody. I'm sorry it's been so long since I was up on here last, but I've been dealing with a migraine for the last 6 months or so. So I finally decided I was up to doing this, and as you can see, I am out and about, and this is actually the nature trail right by my home. Today, I really want to talk to you guys about primary care physicians and how important they are. The first thing is PCP, primary care physician. That's the doctor that you go to for most things. So sometimes they're called a GP, sometimes it's like the family doctor, but the primary care physician is your first line of defense whenever anything happens. The really big thing about it is, depending on what insurance you have, they also can be the gatekeeper to all your other treatments. That's what really concerns me and what I really want to focus on with this. If you have an insurance program like Medicare or pretty much anything that's, they also refer to POS and a couple of others, something where you can choose who you go to for anything beyond what a primary care physician goes to without having a referral. With that coverage, it's not as essential to have a really good primary, but it's very helpful. However, if you're on an HMO or other program with a really intertwined base where you can only see certain doctors, usually your primary care physician is designated as the person who determines what other care you need. So, for example, if you're on an HMO or similar program, if you need to see an allergist, you can only see the allergist if your primary care physician agrees that you need to see an allergist and writes a referral for you to see a specific allergist. It's messy. So when you're dealing with things like that, what's really important is that you have a primary care physician who listens to you, who understands you, who respects your opinions and knowledge, and who can make sure that they're referring you appropriately to the right people and doing so pretty effectively. If your primary care physician is not needed for these referrals, then it's still important to have a high quality one, because basically they're the person you go to anytime you get sick or you're not sure where to go. So the better quality your primary care physician is, the more likely you are to be referred to the right person, and the more likely you are to have them support you while you're trying to do this. Some doctors are willing and able to call other offices and push your case if the situation warrants it. So if you're dealing with something severe, they find it late, then they can say, call the neurologist you need to see, or call one of those offices and just say, hey, this is a priority patient, help them get it. And the bigger part is they simply know who to refer you to, and to say, okay, with the way these symptoms are, I think you need to see this particular specialty instead of that particular specialty, and, guide you along those ways. So either way, they're important, but it's just extra important if you're on an HMO or other program that the only way to get the treatment you need is through your primary care physician. So I just wanted to talk about those things. What makes a good primary care physician? All the traits that make a good doctor. And I'm actually going to be talking about those traits and how to determine if you're seeing a good doctor and kind of what to do if they aren't. I'm going to be talking about all of that in my live on the 7th, where I'm going to really go into some detail about what to expect from doctors, what to think about when you're selecting a doctor, what to think about if you're thinking about changing doctors, and how to make sure that you're getting the best possible treatment, at least in regards to who you're seeing. There's a lot of other parts to it, of course, but this particular talk is going to be focused on who are you seeing, how do you decide that they're worth continuing to see, and what are you going to get out of having those appointments and getting that better quality help. So I hope to see you guys all on the live on the 7th. And I also plan to get back on track and doing these more regularly. For now, I'm really glad to be back and looking forward to seeing you guys soon. Thanks so much. Have a great day.